The smell of smoke and poor visibility with us for a third straight day. Things could change soon, though. Precautions, though, still need to be taken, not just for people, but for pets. Let's go to Global's Shallima Maharaj. Shallima.
Good evening, Alan. For the last several days, the city has been enveloped by that thick and at times extremely pungent smoke. Some of the people we've been talking to told us about symptoms like dry, itchy eyes or itchy throats as well. And so all of that irritation, that comes as little surprise given the air quality that we're dealing with right now. That's what has healthcare officials urging people to limit their time in the outdoors and to pay extra close attention to those advisories.
For 25 years living in Toronto, that's the first time.
The first time Oleg Plekov has seen this level of haze in the city.
Last 2 days very bad, like the smell is different.
Right now, there are 56 wildfires actively burning in Ontario. Toronto has been blanketed by forest fire smoke, bringing with it considerable air pollution.
We have the Air Quality Health Index, which is a value typically between 1 and 10. Usually we sit between 1 and 3. It was above 10 for periods of time over the last few days.
The University of Toronto's Matthew Adams says what we're dealing with is fine particulate matter.
And the problem with them is they don't get caught in our nose or in our throat and get expelled like larger particles would. They can travel deep into the lungs, into the bloodstream, and really travel to every organ of the body.
The immediate effects could include shortness of breath, dry eyes, and irritation of the nose and throat. Toronto Public Health is advising people to reduce the intensity of any outdoor activities or reschedule them altogether.
We have a zoo international management system where we have all our animals on record. So the first thing was to look at which animals had a history of any kind of respiratory illness or disease.
At the Toronto Zoo, animals that are most susceptible are being kept indoors. That also includes pregnant, geriatric, or very young animals.
One of our gorillas has had pneumonia a number of times. He's a younger animal, but he's predisposed to pneumonia. So that's an animal that has a respiratory illness.
For pets, it's also important to minimize exposure. The Toronto Humane Society recommends shortening walks outside.
Elderly animals, animals with underlying health issues.
And brachycephalics, dogs and cats with shorter, smushy faces, which are already at increased risk for respiratory disease. Now, the Canadian Lung Association on its forest fire webpage does issue a few tips as well. They suggest that people limit their time outdoors, keep those doors and windows at your homes shut, and as well, if you are considering going outside to exercise, maybe reconsider that for the sake of your health.